Doctor. Take it away.
Okay. Well, I'd like to welcome you all to Baldwin Hills Crenshaw. And I'm going to, first of all, say that I very much support using masks. But everybody is more than 6 feet away from me. In the interest of them being able to hear me carefully, I'm going to remove my mask only for this, okay? So, before we get started, I'd like to thank a few people. I'd like to thank Yolanda Williams from Intentional Talk Radio for promoting the availability of serology testing for COVID-19. I'd like to also thank Jason Lombard of the Baldwin Hills Crenshaw Mall Community Relations Group, the GUARDaHEART volunteers who you see setting up over here, the Crenshaw community in general, who have been just extremely polite and careful about social distancing and following all the rules. Gina Fields, who's a community organizer who brought water and snacks for the volunteers, and she also has a booth behind us. She will be giving out hand sanitizer and things. Robert Saucedo, who's the CEO of Community Build, we lost a number of our tents, and he donated 3 tents to the GUARDaHEART Foundation. And finally, Captain John Pintos of the Baldwin Hills Crenshaw Police Department and their entire staff, who not only did they get tested, but they were very supportive. So with all of that out of the way, what I'd like to do is just briefly run through what we did here. The data that I'm giving you today is based on 2,026 patients, 2026. It was 56% female, 44% male. The positivity rate for antibodies to COVID was 8.7% in the female group and 11% in the male group. Now, when we looked at a breakdown based on ethnicity and race, the Native American population, which represented about 3% of the patients that we tested here, had a 14% positivity rate. The Asian population, which represented about 7% of our tested population, had a 6% positivity rate. The African American population, which represented 32%, had only a 2.5% positivity rate, which is incredible based on national averages. The Hawaiian ethnicity group had a 16% positivity rate. The Caucasian population, which represented about 25% of the patients, had an 8% positivity rate. The Hispanic or Latino population represented 44% of the tested population. It had a 13% positivity rate. And there were 27 children tested under the age of 10, and they had a 14% positivity rate. The overall positivity rate in this area was about 11.5%, and it'll probably end up being about 12%. The current prevalence for COVID-19 in the U.S. is around 1.7%. So it is significantly higher than the general population that we're seeing now. And that can be ascribed to the fact that this population is in a lot of service jobs, has less access to health care, and has more comorbidities like diabetes and obesity, cardiovascular disease. Now, given that, I would like to make a few observations and a few comments. Number one, we found that people were following the directive for social distancing and masks and hand washing extremely well here, better than some other areas we've tested. And we think that the community support and the efforts to get that information out was extremely important. However, a few questions have come up to me during the process, and I'm going to address those, and then I'll be happy to answer any other questions. But number one, if you have antibodies, do you need to be quarantined? All the evidence says no. If you have antibodies, what it means is that you have been exposed to the virus, you had an infection, and you have developed an immune response to it. Virtually all of the data says that once that occurs, it's not 100%, but your likelihood of infecting another person is very low. Okay, so number one, you do not necessarily need to quarantine these people. The other thing is that the majority of the people that we tested had either no symptoms or very mild symptoms, like a cold, okay? And there is some concern about what do these people who don't have symptoms mean to the population in general. Are they like Typhoid Mary and they're passing it around to their friends and whatnot? And it turns out there was a paper that came out last week, it's published in the journal Cell, that indicates that most of the people who have asymptomatic infections have extremely powerful T-cell immune responses in their body that makes them minimally infective, okay? So that's very important to keep in mind, because there is conflicting data out there that says these people are transmitting infections equally to people who are very symptomatic. But the bottom line is this paper that was peer-reviewed and published in Cell was very clear about the power of those T cells in those people. In fact, some of them may not even get antibodies. The T cell part is so powerful. Now, for those of you watching, there's two different parts to your immune system. One is T cells, and they directly attack the virus. They're cells that just grab the virus like a Pac-Man and chomp on it and get rid of it. The other part of your immune system are B cells, and B cells make bullets. They make antibodies that are like bullets that are aimed at the virus. They neutralize the virus and get rid of it. And related to the B cells, which make the antibodies, there is a lot of concern in the population about what you've heard about antibody levels dropping off and that you become susceptible to infection again. Again, there are multiple papers now coming out showing that it's very unlikely that you will be infected a second time. And what happens when your antibody levels drop off, that is a normal part of your immune response, because what you have in the background are things that are called memory B cells. And if you encounter the virus again, then what happens is those memory B cells start firing those antibody bullets again at the virus, and they clear it very quickly. Also, your T cells, you have memory T cells too. So all of the data now is suggesting that we may be getting closer to herd immunity. And again, for those watching this, herd immunity means that so many people have had the infection and survived that the virus cannot jump from person to person. And initially the thoughts were, all the models suggested maybe it was 70%. And now we're dropping down into the 40 to 50% level, and there are some papers coming out that suggest 20% might do it. But I think the good news out of all of what we're finding with this is that there are a lot of asymptomatic people in the population that have developed antibodies and are resistant to it. There are also a significant number of people who have T-cell immunity, which means that they may not develop antibodies, but the virus can't jump from person to person. So the bottom line here is I want to give you a message of hope. This is a serious illness that you have to take very seriously. You need to take protections. The one area that people have neglected to inform the public about is restrooms, toilets, okay? We've looked at where the clusters of infections have occurred, and they're often in families where they have a single toilet in the building or that they use. And the problem is that toilets can fling droplets up to 20 feet away. And you know that they're testing sewage right now to detect outbreaks. So for us, it's really important that, number one, when you go to flush a toilet, because the virus comes out in urine and feces, you need to either have a mask on. You definitely need a mask on when you flush the toilet. But hopefully, if you have a cover on the toilet or a lid, close the lid too. And then wash your hands very carefully afterwards, because that appears to be an area that was not really recognized right away. So those are the main takeaways here. And again, the GUARDaHEART Foundation, just for everybody watching, is a not-for-profit 501c3. Their motto is Learn, Detect, Prevent. And we are currently doing this throughout California, Michigan. We're going where there is low availability for testing. And I want to stress that the patients that came here for testing do not pay for their tests. They aren't free. They're covered by the CARES Act as long as it's ordered by a physician. And as you can tell, I'm one of the physicians on site. We have volunteers. We have telemedicine. We actually have people available to talk to them, patients, about their results if they don't understand it. And in general, we're just actually really intrigued by these results because they say that we're actually making headway here. And finally, I'd like to let you know that there's some old drugs that are showing very much promise in hospitalized patients. One of them came out of a UK study. It's called dexamethasone, very inexpensive. One of the reasons people die is they get something called a cytokine storm, where their immune system forgets who it's trying to attack, and instead of going after the virus, it goes after your own body. Turns out this old drug that's been around for years can stop that cytokine storm and really reduce the death rate. We're already seeing that. And there's other promising things coming out that I think people need to keep in mind. So in general, that's the extent of my comments, and I'm happy to answer any questions that you might have.
There's one question someone asks is, can you get the coronavirus twice?
Okay, the question is, can you get the coronavirus twice? And the answer is most likely not. The reports of people having second infections were due to using what's called the PCR test. This is the swab test. And it turns out that the infectious period for the virus is from about 2 days before you get symptoms to about 10 days. So a safe period is 14 days. And what happens after the 10th day is that your body has neutralized the virus to the point where it is not infectious. What we're detecting, because the PCR test or the swab test, it can't really distinguish between living virus and dead virus. And those initial reports were based on the fact that you can secrete virus up to 30 days afterwards, but after about 10 days, that virus is dead and it's not really infective. And the behavior of other coronaviruses does not indicate that reinfection is likely. So I think we just have to be careful. We still don't know everything, and what I tell people is, based on the information we have today, this is our best data and best recommendation, but it's very unlikely that you're going to be getting a second infection. Okay?
How about surfaces? And touching surfaces, how long does the virus last on surfaces that are still as much of a danger as the
So the question is, how long should we worry about the virus lasting on surfaces? And again, I'm going to, the earliest studies sprayed massive amounts of virus on surfaces to determine how long it lived there. In the real world, the amount of virus in a droplet that lands on a surface is relatively low. And so the original, some of those reports said up to 5 or 6 hours or even days. It's probably measured in hours or minutes. Maybe I've seen several studies, and it depends on the surface. Like stainless steel can support the virus longer than something that's absorbent. I will tell you that if I go out and I take a swab of a doorknob and I do one of these molecular tests for a number of viruses, I will detect DNA or RNA from that doorknob, but none of it is infective because it's all desiccated and dried up and damaged. But that doesn't mitigate the fact that you have a responsibility to wash your hands and wear your mask and make sure that you take all the precautions, because they do work. There is absolutely no question that masks have cut the infection rate by up to 50% if they're worn properly. And so the bottom line is that you need to be careful of all surfaces, but it's not as bad as some of the initial studies suggested.
One more question. Like the flu, where the virus morphs every year, do you think that the same thing will happen with COVID-19 this fall or winter, that they morph?
Boy, I wish I knew. That's a hard question to answer because we're only 7 months into this. And in 7 months, we have 5.5 million people infected. And I think if you remember in 2009, with H1N1, flu, we had almost 40 million people infected at this time, and there was a seasonal variation on it. Now, some evidence suggests that this virus does not like heat, and we're in a very hot part of the year, and oftentimes during the winter, people are confined indoors and they're more likely to spread. You can see a bit of a spike, but it turns out that we're starting to see more of a leveling off. The number of people hospitalized, the number of respirators being used is significantly down. And so I think the only way I can answer that question is we're just going to have to wait and see. If it behaves like other coronaviruses, then what happens is that it will be seasonal to some degree, and we may see this in the future. One last comment before I answer the next question. There is a attenuated strain appearing in various parts of the country that is not as aggressive as the original strain. There's not much known about it now, but we're seeing more in California and I think Florida. So there's some good news there, because that frequently happens to viruses. They're very virulent to begin with, and then as they go through the population, they wear out or become less infective. Yes, Gina?
Can COVID-19 be transmitted through air conditioning systems in office buildings?
So the question is, can COVID-19 be transmitted through air conditioning systems in office buildings? And the short answer is they're supposed to have filtration inside those that would remove viral particles. The real question is, would they survive the transmission through the turbulence and all of that? And I think most people would say it's probably not a major source of infection, but it's something. I mean, look at Legionnaire's disease. You know, it came from water coolers and things, some coolers, that sort of thing. So I think we just have to be careful. But if they're well maintained, you should be relatively safe. Okay?
Will we see new or different strands of the virus?
Yes, that's what I was just referring to. The question was, are we seeing new or different strains of the virus? There have been a number of publications in the last few weeks that have indicated that there are some changes to the virus. Here's the good news, though. The flu virus mutates very rapidly. That means it's changing every year. The coronavirus does not appear to be able to do that as easily as the flu virus, which is all really good news, because the latest strains appear to be less dangerous than the original strains. Now, that's only been seen in a few spots, so that's just very preliminary, and that could change. Okay. Any other questions?
I just want to clarify. So if you had COVID-19 months ago and taken antibody tests today, will it show antibodies, or is it the memory thing?
Yeah, so the question is, if you had COVID a number of months ago and you took the antibody test today, would you be positive? And the answer to that is possibly. And I'll tell you why. Because the behavior of the antibody is as follows. You have a peak at about 7 to 10 days in your body where it's clearing the virus and your immune system is really revved up. What happens after that is that in 73 days you have half as much of the antibody. And in another 73 days you have half as much of that. And you may get down below what we call positive, but you still have the memory B cells. So usually if you add two 73-day periods up, after the first 73 days we may or may not call you positive, but your number will be higher than somebody that's never seen it. Okay? So I hope that answers your question.
Should we all be getting our flu shots sooner than usual this year because of the coronavirus, or just...
Well, the question was, should we all be getting our flu shots sooner because of the coronavirus? The flu has not gone away. We are still seeing patients with flu. It's just that there's so much focus on COVID that I'm not sure that the reporting is accurate. We're currently going to implement flu testing because we're entering that time of the year. And the short answer to your question is you absolutely should get your flu vaccine, because it's very effective at reducing the risk of having it. And if you're in the high comorbidity group, like if you're over age 65, you're in a nursing home, you have diabetes, you're overweight, you have cardiovascular disease, have had an organ transplant, you absolutely need to do the maximum you can to protect yourself. And that includes sleep, anything to boost your immune system, like vitamin C, vitamin D. Vitamin D has been shown to reduce the risk of infection and the severity of the disease, as long as you have adequate levels. So there are other good things out there that you can do for yourself, okay?
Any after effects like scarring of heart tissue or anything? Because I've heard
Yes.
from a couple of people.
Yes, so the question is, are there any after effects or lasting problems and from the virus? And the answer is yes, and possibly. The virus has to bind to a receptor called ACE2. ACE2 is related to regulation of your blood pressure, and it turns out that the most dense population of ACE2 receptors is on the lining of your arteries and in smooth muscle in the heart, okay? And so what that means is that when the virus infects you, it causes a lot of damage to the arteries and directly to the myocardium. And most people can heal that. Most people will clear that and then be fine. But if you have something like diabetes, or you have existing coronary artery disease or congestive heart failure, it can make a bad situation worse, and you can end up with lasting complications. So most people will do fine. The lungs can possibly have some scarring, and the reason that you see strokes and heart attacks in younger people is because when the lining of your arteries is damaged by that virus, it predisposes it to form blood clots there, and that's the whole mechanism. So one of the treatments for these people is to give them some of the cardiac meds that we use, like to inhibit platelets, which help clot blood, or anticoagulants, and they've worked. So, okay. Any other questions? Okay. I guess that's all I have to say, and again, I just like, yes, I'm sorry, go ahead.
Are you seeing a difference in the positivity rates for the COVID-19 antibody test in LA compared to UC?
So the question is, are we seeing a difference in the antibody positivity rates in LA versus other parts of the state? The answer is yes, significantly so. So the overall positivity rate here, and we're not done, by the way, we still have this week to incorporate. This is just the first 2 weeks of data. It's about 11.5% to 12%. If you go south to Orange County, it's somewhere in the 1% to 3% range. And up in Northern California, in some of the nursing homes, we had 0 antibodies. And in another nursing home, we had 3 out of 100 with positive swab tests. So there are regional differences. It seems to be related to the density of the population, the access to health care, the level of comorbidities in the population that's being tested. And so I think that's all explainable, but there is definitely a difference. Okay.
Do people who are asymptomatic need to be quarantined, and if not, why?
So the question is, do people that are asymptomatic need to be quarantined? And I'm assuming that you're referring to the fact that they're positive with antibodies. And the answer to that is no. If they have IgG antibodies, they are very unlikely to transmit the infection to other people. But that doesn't mean that they can party like Chris Farley. What it means is they have to be courteous to their fellow people and still practice the same safe behavior with masks and gloves and hand washing and being careful in the bathrooms. Okay? Any other questions? Yes, Gina?
What should people do now that they know the results? If they know they have the antibodies and they know they don't, what should they be doing? Or how does that affect other people that come in contact with them?
Okay, so Gina asked the question, if they know they're positive, what should they do? And the people that are negative, what should they do? And so the people that are positive are actually in pretty good shape. They're very unlikely, and they've had minimal or no symptoms, they're very unlikely to have any future problems. The people that are negative, they do need to do what everybody else does, which is to be very vigilant, practice safe behavior around other people. But the same goes for people that are antibody positive and had no symptoms. They can't just go out there and not follow the rules. You know what I mean? they really need to set a good example for other people. They just have a slight advantage in that they're unlikely to have any further problems. Okay? Sure. Good? Okay. I thank you very much for coming. We appreciate it.